Greetings, everyone. I'm John Murphy. Welcome back. I'm with Dr. Bobby Belmonte from Maximize Living. We're going to give you another example of just how important essential number two is, the maximized nerve supply and that whole communication system going on within each one of us, between the brain and the tissues, the organs, virtually every cell in the body. So with that, I'm going to turn over to Dr. Bobby Belmonte, who's going to give us another incredibly powerful case example.
All right, thanks, John. You know, your spine controls everything. It's really your brain that controls everything. It's an amazing intelligence that lives within the body. And it beats the heart, right? Your brain controls the lungs. It breathes your lungs. When's the last time you had to consciously beat your heart? You see, there's a super center inside of your body that's continually working for you. And it always is working to help you. And your body depends on the brain for good communication. And you know, as long as the brain can effectively communicate to your body, then your body's going to work exactly the way it was designed to, which is great. However, what we're finding is that a lot of people have problems that just don't seem to go away. They're doing all the right things. They're working out. They're going to yoga. They're getting adjusted, maybe even by another chiropractor. But yet their problems keep coming back. And I always found this interesting when I was first studying chiropractic, that people would have problems, get adjusted, the problem would go away, but only for a short period of time. And typically the patient would come back when the problem came back. And what I found was if we make choices based on how we feel, well then that thought, you know, that process would make sense. As long as I feel good, I must be good. But unfortunately, what you don't know can often kill you, at least when it comes to your health and well-being. If you had damage on the nerve going to the heart, right, when would you want to know? Right away. And so one of the things we do in our office is we test function of the nerves. If we determine that the problem in the nerves is coming from a spine that's potentially damaged, then we're going to take x-rays so we can see exactly what needs to be corrected in the spine. And so behind me is a case study of a middle-aged woman. She's been getting adjusted for 14 years, and she's got headaches. And she's had headaches for 14 years. And you know, my question is simply, if chiropractic was working, wouldn't the headaches just go away and stay away? And so it's not that chiropractic wasn't working, but what I found after I started asking her more questions is that she would only go when she got a headache. And what she was doing for 14 years was making decisions based on how she felt. Even though she was using something good like chiropractic, the problem is if your spine's going through a process of degeneration, getting adjusted once every 4 to 6 weeks isn't going to change or correct a spine. And another doctor that I like to compare ourselves to is an orthodontist. And they put the braces on the teeth to straighten the teeth, right? And you have to wear the braces typically for 1 to 2 to 3 years, and you wear them all day, every day. And the same laws apply to your teeth in your jaw, apply to your spine. And so if I'm going to correct the spine so I can structurally improve it, keep the pressure away from the nerves so your body will get well, stay well, and then be well for the rest of your life, well, that process looks very different. And so what we did is we talked with Sally, and we walked her through a plan over 4 months. And we put together the rehab necessary. We put together a game plan for structural spinal correction based off of specific adjustments, based off of what we learned from her x-rays. And over the course of 4 months, we take her out of that second stage of spinal degeneration back into stage 1. On the right, you can see the head's coming back over the spine where we want it. It's straighter as opposed to a negative curve. On this left side, if you can see the curves going actually in the wrong direction, you would want the curve 45 degrees the other way. And this is what continues to bother her, not just causing her headaches, but when I meet her, she's also on 2 medications for her thyroid, and she's gained 100 pounds unexplainably. And she just can't seem to figure it out. She's doing everything right. She's done the South Beach diet. She's doing P90X. She's tried a handful of other diet and exercise programs, and she could always lose the 10 pounds. but she can never figure out how to lose the other 60, 70 pounds and how to keep it off without it just coming right back. And if you can see here, from the top to the bottom, 1, 2, 3, 4, that's significant because at C4, those nerves control your thyroid. And if your thyroid's going to function properly, right, the brain must be able to talk to it. Can you imagine if I cut the nerve to the thyroid, what would happen to the thyroid? It wouldn't work at all. And so we took her out of stage 2, back into stage 1. This is 4 months worth of corrective care. And in that process, not only are the headaches gone, but they haven't came back. She's off both medications for her thyroid. She's lost 30 pounds. She's on her way to a full recovery. And the reason is that we got to the cause. And we put together a plan for correction based off of function. I mean, she's been feeling great for months. And she's going to keep working hard at her spine because it is the supercenter of how your body works. Now, John, we do need those other essentials that we've talked about before, right? I mean, food's important, right? Exercise, oxygen. But it's really, at the end of the day, you can throw all of that out the window. If you don't have a healthy spine and nervous system, then you're just not going to get what you want out of your wellness choices or your lifestyle choices.
Absolutely, Bobby. When I first came in here, I was, and I continue to practice the other 4 essentials, the mindfulness. I meditate every day. I teach meditation. You know, the food and the nutrition we put in our body, the detox and the exercise and the right form of exercise. But I was really blown away by my initial assessment. And it wasn't that I was in any pain. And I even have had a spinal fusion at the C7 16 years ago. But I've recovered from that. But it was some of the things you pointed out to me that reminded me how important it is to be proactive. So the real takeaway from this is don't wait until you're in pain. Don't wait until you're obese or you're suffering. Be proactive and get an assessment and see what it tells you. Because if your communication system isn't working effectively, your organization, that is your body, will break down just like any other organization or family or team. All right, so that's it for today. I'm John Murphy with Dr. Bobby Belmonte from Maximize Living. We're here to help. God bless.